And I'll tell you about those free market principles in a minute. Now, the access to care is not as good as it should be. It's unacceptable that people who are poor have trouble finding a doctor. And again, it's because healthcare costs are too high, and they can't buy overpriced health insurance. And it's unacceptable in America that some people are forced to go without good medical care because we've created this third-party payment control system that drives up costs. Medical inflation has outpaced consumer price index for all other goods, 5, 10, 15 times over the last many decades. And every time they create a new system they think is going to control it, HMOs, certain price control measures in Medicare, it just keeps going up higher. Because if you're in the game and you know how to play the game and no one is checking on how you spend the money, you know how to get the money. Hospitals know how to get the money. Doctors know how to get the money. And when you come into my office and I say, I'd like to order an MRI, you don't ask me, well, how much does it cost and do I really need it? You say, well, can I have 3? I'm not paying. I paid my health insurance premium. I'm going to get every darn buck I can back on that. That's the attitude. That's wrong. That's taken the consumer out of decision-making in healthcare. And it is the consumer that keeps costs down and keeps quality up. Now, before I talk about some good health system reform ideas, I want to talk about some myths that are out there so you can be armed to debunk myths that you encounter. And I want to describe the congressional proposals and give warnings to Republicans so that they don't adopt these bad things. First myth is the myth of the 47 million uninsured Americans. According to the Bureau of Labor and Statistics, 9.7 million of those people are not American citizens. They are not American citizens, and yet they walk around creating a crisis. Remember what Rahm Emanuel says, never miss an opportunity to take advantage of a crisis? His corollary is create a crisis. Okay, this is classic crisis politics. 47 million uninsured. A simple falsehood. 9.7 million are not Americans. 8 million are eligible for government insurance programs but don't sign up. 16 million earn greater than $50,000 a year. Half of those over $75,000. But they haven't found a health insurance product that they want to buy that isn't overpriced and undervalued. So they don't buy it. It's not that there are people who are uninsured, it's that people have made a choice. Thank God they still have a choice in America not to buy, I'll keep my language nice for the sake of my daughters in the room, not to buy bad insurance. Okay? Let's look at another myth, medical bankruptcies. President Obama had the audacity to get up in front of Congress and say that an American goes bankrupt every 30 seconds because of medical costs. Well, if you do the math, that's over 1 million medical bankruptcies a year. Well, if you have a simple fact check, you'll discover that bankruptcies in the year he quoted were about 800,000. And if you spend a little time reading and look at a study from UC Davis, you'll discover that really, from medical bankruptcies, only 5% of those bankruptcies, all bankruptcies, were due primarily to medical reasons. So if you really look at it, medical bankruptcy rate is somewhere down below 100,000. Now, people do have problems from high health costs. They do have bills to pay. But this is another crisis mentality myth that's being used to push a bad agenda. Another myth, 98,000 people die every year from medical errors. Simple falsehood. Now, if you look at the study, as I have done, as I've studied for years on this in New England Journal of Medicine and others, what they did was they looked at, I've got to remember the numbers, they found 70 deaths in New York State from data that they then extrapolated from those 70 deaths that they claimed were from medical errors to the entire country. They used a statistical gimmick. And when you look at the deaths, they weren't even really linked to medical errors. They then said, well, we have to cut this rate down by 50% over the next several years. So what did they do? They repeated the study in 1992. The first study was in 84. In Utah and Colorado. And they found that the extrapolated death rate was 44,000. You'd think that was a victory. They cut them down in half. No, no, no. They're riding that train because they want to scare you into believing that it's going to take a bunch of government bureaucrats and insurance company bureaucrats to create good quality. Well, as Republican Congressman Tom Price, who's also a doctor and a friend of mine, loves to say, the government can never be in the business of defining quality and efficiency. Once we give the power to government to define what quality is, we're going to have a kind of quality, but it will be bad quality. And this is exactly what's coming. They want to give government bureaucrats a definition power for quality, and I'll describe that in a minute. And then the biggest myth of all is that the government can fix these so-called problems. I don't know, you've probably seen the book of the problems that government has solved. It's a very short book with a lot of blank pages. All right? Typically, I find when the government gets involved in trying to solve a problem, they usually cause a lot of other problems. And I'll describe some of the problems that have been caused. If you keep your eye out, Crofton West or St. Pete Times, whatever you like to call it, you'll see an op-ed from me this week that are coming out on hospital report cards. Now, last week, they had a hospital report card story saying that certain hospitals get a plus sign for being good quality, certain other hospitals get a negative sign for being bad quality. This is called public reporting. This is at the centerpiece of what is proposed in Congress. And where did this come from? This came from President George Bush in the year 2004. And it has been embraced and adopted vociferously by President Obama and his friends. Because what is it? It's central economic planning. And if you take some time to understand socialism and big government, at the core of it is a tool called central economic planning and collectivism, whereby all the money and all the power is put in the hands of a few technocrats, and they decide how it will be spent, and they decide whether or not something was done properly. Okay? So in this model, you have these committees, which I have sat on, representing the specialty of neurosurgery in DC. After sitting on them, I had to go take a shower, let me tell you, because it was all politics. These committees set quality standards. And you'd think it would be a bunch of erudite, well-informed discussion among doctors about deciding whether or not we're going to use X antibiotic or Y antibiotic. No, no, no. What it's about is who's in the room with the votes. Which specialty is going to avoid getting gouged by the government regulation this week? And how are we going to trade it? And what promises are we going to make so that 5 years from now, when our specialty is up, we're going to take a little pain then to avoid more pain now? It's all politics. So here's a good example of a measure that they created to call quality. If people have a heart attack, they should have certain drugs. One is called a beta blocker. Some of you may take beta blockers if you have high blood pressure. Now, the government committees set a standard that said within 24 hours of a heart attack, a myocardial infarction, you should have a beta blocker. And if your percentage is high enough, we're going to give you a gold star. We're going to say you're a good quality hospital. Well, what they failed to do when they created that thing in 2005 was to read any scientific studies on the matter. Because the committee that created that in 2005 should have looked at a study in that year, a big one, called the COMIT, C-O-M-M-I-T-T study, that said that if you give beta blockers to some people, like those with heart failure, they go into shock and they die.
Wow.
And so what happened? The hospitals created forms. They created committees. They created caseworkers and people who used to be nurses who are now being paid to be administrators. And they'd walk around and go, get that drug, get that drug, get that drug. We need a good score, we need a good score. And any doctor who would complain and say, I'm practicing medicine here, bad doctor, disruptive physician, peer review, we're going to penalize you, how dare you speak against our great, beautiful, noble vision. People die.